Hey everybody, Nick the Fiber Guy back again with my video of, I've already gone into the anxiety panic attack and history of how I got to the point where I'm at right now in life, and um, now I'm going to get into the fibromyalgia. So, as I explained, I started to deal with the severe pain in all of my joints, and my doctor kind of shrugged it off. Um, but it became really serious. It was one Sunday morning when I was in bed and I woke up and it had already become painful to get. I mean, when you first put your feet on the floor when you get out of your bed in the morning, um, I don't think anyone who has ever had hasn't had fibro or rheumatoid arthritis can really understand what the feeling is. Um, it's just pain, and it just shoots and it throbs, and it's every inch of you. I remember one day my wrist was probably swollen up to here. My hands tend to get very swollen. You can see the inflammation easily in certain joints of my body. It was quite scary actually to see yourself swollen and not know why your body's swelling up. Um, and somebody with anxiety disorder and obsessive compulsive, your mind just races and it just causes so much extra stress that it's really tough, especially when you're alone. You don't have anybody to be with, to spend time with, to just take your mind off of things. So I went to my doctor and we did some blood work. Actually, no, I'm sorry, I'm way offline. I'm sorry. Recently I've discovered that I tend to lose track of thoughts, and it's believed to be part of fibro fog. So I apologize if my story sometimes skips or I mess up. I apologize. Um, so it was a Sunday morning, and I was basically stuck in bed. I couldn't get out of bed. Luckily, my laptop was next to me, and I actually contacted my ex to ask her if she could take me to the emergency room, and she was like, no, which I don't know why, but it's her stubbornness, I guess. But I basically posted a comment on Facebook, and luckily enough, a coworker of mine who I really don't know that well. I mean, we've spoken, we get along at work. Hey, what's up? How you doing, bro? I've seen him at the casino a few times. He was willing to come and pick me up, take me to an emergency room so that I can get help. In the emergency room, they just basically gave me an IV. They ran blood tests for Lyme disease, lupus, a number of things. The only thing they didn't test for was rheumatoid arthritis and fibromyalgia. They gave me morphine, which was the first time I had ever had morphine, and it was, the doctor asked me first what was my pain level, 1 to 10. I told her 12. After the morphine injection in the IV, I was asked the same question again, and it was 0 because you could have hit me in the face with a brick, and I wouldn't have felt a thing because of the morphine. I never had morphine before. You have to forgive me. My cat has decided to tear off a piece of something and chew it. She's not allowed to do. And you're bad. Sorry about that. Anyway, so yeah, so they basically just prescribed me with like arthralgia, some kind of weird arthritis. It was an emergency room visit, and you know how emergency rooms is. Just get him in, get him out. Gave me some Percocets and sent me on my way. The Percocets basically help to a degree. Once you have fibromyalgia, rheumatoid arthritis, you're always in pain. There's always a pain somewhere in your body. It doesn't matter where, there's a pain. I can't really explain it, but I woke up today and I couldn't extend my left arm. That's about as far as it can go right now, and it's swollen here, and it hurts really bad. And so when I'm going to reach for things, I'm finding myself dealing with the pain. Although my legs don't hurt, my hands don't hurt. There's always some form of pain somewhere. So I ran out of the Percocets, and basically Was let go of my job with an understanding of how the situation was. So I'm on unemployment, etc. And disability. And anyway, um, so I went to see my doctor that following weekend because I was out of Percocets and the pain. I mean, you can only take so many Advil and Aleve. I mean, it doesn't do anything. So he did some more blood work, and but didn't test for rheumatoid arthritis, which I just don't understand. But he did give me a rheumatologist referral who I went and seen, which was extremely expensive and completely. I just didn't like the lady. She's still my rheumatologist. I just don't like her. I don't feel like she really is is really trying. I feel like she just wants to give me the quick fix and send me on my way when I deal with this every day. What she prescribed me was prednisone, which is a steroid, which actually helps. Which a coworker one day had given me, and it actually was the only time I felt pain free. So I had brought that up to the doctor, and that's why I guess she gave it to me. But it's something that's extremely bad to take on a long term basis, especially for men. It can deteriorate your bones. It's not healthy to take, although it takes away the pain for about a 12-hour period at a time. And she wanted me to get tested for RA. So I went back to my doctor, had the RA test done. It took a week to get the results. That cost money. Go back to the rheumatologist. Cost money for another visit. Basically, what had happened was, and I really should pull out my paperwork to really show. If I can find it. Hold on, give me a second. Let me see if I can find it. Okay, no, this is not what I need. Sorry. So much paperwork. Sorry, guys. I don't know what I did with it. It's around somewhere. But anyway, my RA test came back negative, which was odd. Because my own doctor basically said it's probably RA or fibromyalgia. But my inflammation levels came back extremely high. There's a 30 to 40 ratio of what an average, I guess, arthritic person should come back on a blood test with inflammation levels. Mine was a 93. She took off my socks and pulled up my sweatpants, and she could clearly see the swelling that was in my feet and my ankle. My left ankle especially, it's still really bad on a day in and day out basis. My elbows are bad. My shoulders are really bad. Those are the key points. But every day it's another little joint somewhere that all of a sudden just hurts. And then those mornings where I don't take the prednisone at night, when you wake up, it's just like, get out of bed. Are you kidding me? Anyway, the sad thing is that she told me basically she believes I'm still a victim of rheumatoid arthritis, that there's actually the possibility that a lot of people come back negative when they test for RA, but that some of my symptoms actually are rheumatoid arthritis symptoms, and that I am one of the lucky less than 5% of people that actually have some sort of weird combination of both rheumatoid arthritis and fibromyalgia. Congratulations to me, and prescribed me another refill of prednisone. At the time, I was starting to deal with the flu, so I was sick. But what I've been prescribed is, I don't even want to say this name wrong because I haven't started taking the medicine yet. But it's methotrexate or something like that, and folic acid. Basically, methotrexate or whatever it's called is used to fight chemo, radiation, leukemia, to help with abortions, and basically it causes very bad side effects when you take it. Hair loss, etc. A lot of bad things. There's a lot of bad side effects that come with taking this drug at a certain milligram dosage. I'm at 2.5, and it's something you have to take 6 pills all in one time. It does cause you to be extremely nauseous, and then every day for that week that you don't take any more, you have to take the folic acid, because the folic acid combats the side effects, which then supposedly helps. I haven't begun to take it yet. Today's the first day I'm actually really not that sick, so I'm kind of scared to start taking it. But I do have to eventually do it sometime to find out if it works, because the next step after this is one of those expensive drugs like Lyrica, and I'm afraid to take Lyrica because of the weight gain that it causes and suicidal thoughts. I have anxiety, depression, panic disorder, whatever you want to call it. I'm really not a depressed individual. The only time I tend to feel depressed is when I look around and I just realize that, like, I'm alone in this. Like, any given day, something bad could happen to me here, and no one's here. I could die, and no one would know for days until they smelled the body, probably. So that's the one thing that I fear. I've been dealing a lot. I've changed a lot. I've become a much more humble person in the fact that I talk to myself a lot more, not in a bad way, but through reading and trying to find out non-medical ways to help yourself with anxiety and the pain, is to talk to yourself, to pray. I do a lot of praying. I'm not the most religious person, although I was raised Catholic. There's moments where I just pray, and a lot of times it's not even for myself. It's just I just pray that no one ever has to feel exactly what I feel. Some people think it's I put on a really good show. I'm not gonna lie. Even though I'm a straight shooter and I'm an honest person, I can be in a room full of people or at the bar hanging out with my friends and having an actual panic attack or feeling an extreme amount of pain and just want to run out the door. But somehow I find this inner strength to fight it and smile or laugh or conduct myself like everything is fine when everyone around me has no clue exactly what's going on inside of me. It's a tough magic trick to pull off, but sometimes I'm able to do it. Sometimes I'm not. I find when the pain kicks in and the stress kicks in, it's two different things. Hot showers help sometimes. Pacing, if I'm able to walk properly without pain, is a huge help. Fresh air from time to time helps. I really don't get out much. So basically that's it. That's basically my story right now. I'm in the testing stages of medicines to see, every fibro RA case is different. Everybody's body reacts differently to each drug. They're trying to help me out by giving me the cheapest medication to start with, because I can't afford, Lyrica and stuff like that. They're like $5 a pill. I mean, you're talking $150, $200 for a month's worth of dosages, and the side effects on that stuff, I don't even know if it's worth it taking. So basically, there's no cure for what I have. It's not going to go away. As I get older, it'll get worse. And it's something that I live with every day. And, this is going to be my therapy. This is going to be the way that I talk. I don't really talk to anybody too much to share it with them how I feel. So I wanted to use this as a form to do that. So if anyone out there knows exactly what I'm going through and wants to talk or has any advice or would like to ask me any questions, please comment or message me. I'll be doing a new video probably later on in the week once I start taking the methotrexate or whatever it is, and let you guys know exactly how that works out for me, if that helps at all. And the sad thing is the prednisone that I take actually triggers my anxiety, which if I take a prednisone, then I take 2 Advil, then I got to take 2 Xanax, and then I'm in bed. And the insomnia that I suffer from, I don't sleep any kind of regular schedule. I'm up usually like 20 to 22 hours straight, and then I'll sleep, 13 hours. It's just crazy. So, again, if anybody has any questions, I would love to, talk or share what I'm going through with anybody out there. Maybe that could help in some sort of way. But thank you for watching, and please stay tuned. and I will definitely keep you guys updated on what I'm going through. Um, and I want to say thank you to some of my friends that have really, on a regular basis, called me. Hey, man, how are you doing? You know, that really means a lot. You really find out who your real friends are when you're alone in the world, and um, you're going through what I'm going through. Some people don't understand it. Some people have friends and family that are going through things and they understand as well. So I appreciate that, and I have a lot of love for those people that care enough to reach out to me to really. It comforts me. It's like a blanket. Like when I know someone cares that I don't expect to care, or someone relates that I don't expect to relate. It's a huge breath, that I'm able to take. And I just want to say thank you to my mom, who's I don't see her very often, but she's been a huge inspiration for me. As far as she's not here, she doesn't see me, but she's helped out in so many other ways. So thank you to her. I love you, and I'll talk to you guys soon. So anybody out there who needs help, questions, hit me up. If not, and you're going through what I'm going through, I pray that tomorrow's a much less painful day for you. So take care.